Okay guys, let's do a rapid review on infectious disease CK step 2. Infectious disease. Don't forget to subscribe and study hard. Infectious disease. The three most common causes of FUO or fever of unknown origin. It is infection, cancer, and autoimmune disease. Infection, cancer, and autoimmune disease. The three most common causes of fever of unknown origin. Sense of criteria for strep pharyngitis. Sense of criteria for strep pharyngitis. It is fever, tonsillar exudates, tender anterior cervical lymphadenopathy, lack of cough, and the age of 14 years old. Cause of pneumonia in neonates. You're gonna remember this because neonates come to the world involved in a little gel from mom, a little gel. The gel is group B streptococcus, Escherichia coli, and listeria. The word gel, G-E-L, is gonna help you to remember the three more infections to cause pneumonia in neonates. That is group B streptococcus, group B streptococcus, Escherichia coli, and listeria. Cause of pneumonia in adults from 40 to 65 years old is streptococcus pneumoniae, Haemophilus influenzae, and mycoplasma. Mycoplasma, Haemophilus influenzae, and streptococcus pneumonia. Cause of pneumonia in adults from 40 to 65 years old. Strep pneumonia, Haemophilus influenzae, and mycoplasma. The treatment for tuberculosis by type is we have two types of tuberculosis. It is active disease and latent disease. For active disease, we use isoniazid, pyrazinamide, rifampicin, ethambutol, and vitamin B6. Repeating, for active disease of TB, we use isoniazid, rifampicin, pyrazinamide, ethambutol, and vitamin B6. For a latent disease, we use isoniazid for 9 months. The splenic patients are particularly susceptible for those organisms. The patients who have been taking the splenic out, they are susceptible for those organism infection. It is encapsulated organism. They are Pneumococcus, Meningococcus, Haemophilus influenzae, and Klebsiella. Pneumococcus, Meningococcus, and Haemophilus influenzae, and Klebsiella. Those are encapsulated organisms, and they always attack people who doesn't have the splenic in their body. What organism can give you Reinhouse and brain lesions? Causes of Reinhouse and brain lesions are abscess, toxoplasmosis, metastasis, lymphoma, AIDS, and neurocysticercosis. So neurocysticercosis, AIDS, lymphoma, metastasis, toxoplasmosis, y abscessos. Those are causes of Reinhouse and brain lesions. Causes of Reinhouse and brain lesions are abscess, toxoplasmosis, metastasis, lymphoma, AIDS, and neurocysticercosis. So for VIH, we have AIDS deficiency illness, AIDS defining illness. AIDS defining illness are esophageal candidiasis, cytomegalovirus retinitis, Kaposi sarcoma, central nervous system lymphoma, polymorpholeukoencephalitis. Let's see what is PML. So PML is progressive multifocal leukoencephalopathia. Progressive multifocal leukoencephalopathia. Progressive multifocal leukoencephalopathy. Progressive multifocal leukoencephalopathy. It is a syndrome of hemiparexis, disturbance in speech. So in a progressive multifocal leukoencephalopathy, you have a syndrome of hemiparexis and disturbance in the speech, vision, and gait. The MRI findings show multiple demyelinating, no in-house lesions with no mass effect. Remember, this is one of the illness of AIDS defining. So AIDS defining illness are PML, toxoplasmosis, PCP, invasive cervical and anal cancer, HIV encephalopathy, toxoplasmosis, cytomegalovirus retinitis, capoxisarcoma, sistema nervioso central lymphoma, and esophageal candidiasis. All of those are AIDS defining illness. I'm gonna repeat it again. AIDS defining illness are esophageal candidiasis, cytomegalovirus retinitis, capoxisarcoma, central nervous system lymphoma, PML, toxoplasmosis, PCP, and invasive cervical and anal cancer, HIV encephalopathy. In this case, PCP means pneumocytic pneumonia. PCP is pneumocytic pneumonia. Pneumocytic pneumonia. This next one is really important. I have seen it a lot of tests. I have seen it in a lot of tests. So pay attention to this one. At what CD4 count should pneumocystis jirovecii pneumonia prophylaxis be initiated in HIV patients positive? Mycobacterium ovum complex prophylaxis. So they ask you at what number of CD4 you should start doing prevention for Mycobacterium ovum complex and for pneumocystis jirovecii. So the answer is less than 200 cells per mm. So less than 200 cells per millimeter for pneumocystis jirovecii with trimethoprim sulfamethoxazole, and less than 50 and 100 cells per millimeter of blood for MAC, for Mycobacterium ovum complex. In this case, we use clarithromycin and azithromycin. So we're gonna repeat again. So in which number do we have to start prophylaxis? And at what number of CD4 count we have to start prophylaxis for pneumocystis jirovecii and Mycobacterium ovum? So for pneumocystis jirovecii, we start less than 200 cells per millimeter. And in so we do it with trimethoprim sulfamethoxazole. And prophylaxis for Mycobacterium ovum complex, we start when the CD4 are less than 50 or in between 50 and 100. 50 and 100 for Mycobacterium ovium complex, and we do it with clarithromycin and azithromycin. So remember, less than 200 with trimethoprim sulfamethoxazole for pneumocystis jirovecii, and less than 100 from 51 to 100 for Mycobacterium ovium. We use clarithromycin and azithromycin in this case. I'm sure this question is going to be in your test. I'm sure this question is going to be in your test. Okay, cause of meningitis in neonates and treatment. Remember, we just discussed this before. Gel, group B streptococcus, Escherichia coli, and Listeria. And the treatment is with ampicillin plus cefotaxime or gentamicin. So we treat it with ampicillin plus cefotaxime or gentamicin. Group B streptococcus, Escherichia coli, and Listeria. This is a cause of meningitis in neonates. So cause of meningitis in neonates is group B streptococcus, Escherichia coli, and Listeria. Remember this. Gel. The kids come to the world involved in gel. So when they come, neonates, they probably gonna have meningitis with group B streptococcus, Escherichia coli, and Listeria. You treat that with ampicillin, cefotaxime, or gentamicin. Next. So cause of meningitis in infant. So those are infants, they are bigger than neonates. Cause of meningitis in infant and treatment. So in infant, we have Streptococcus pneumoniae, Neisseria meningitidis, Haemophilus influenzae, and type B, and we treat with vancomycin and cefotaxime. Vancomycin and cefotaxime. Okay, so cause of meningitis in infant, the treatment. Cause of meningitis in infant is Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenzae type B. We treat it with vancomycin and cefotaxime. Okay, just remember that cause of meningitis in neonates is the gel, group B is streptococcus, Escherichia coli, and Listeria, and cause of meningitis in infant is SNH, Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenzae. The letters tell you PM, that means for a later baby, because neonates is the new babies and the infants are a little more later than neonates. So PM is gonna help you to remember the later babies. PM, pneumonia and meningitis, Streptococcus pneumoniae and Neisseria meningitidis, and Haemophilus influenzae. So what's next? What must always be done before a lumbar punction? So what do you do? What do you check before doing a lumbar punction? So you have to check for increase in intracranial pressure. You have to check for increase in intracranial pressure. How you do that? You have to do a fundoscopy in the eyes, the people's eyes. You have to do a fundoscopy. If you look for papilledema, you cannot do a lumbar punction. If you do a lumbar punction in somebody that have intracranial pressure, you're gonna herniate his brain, it's probably gonna kill the person. Don't do don't do a lumbar puncture in somebody who has papilla edema and probable intracranial pressure. You can drain the fluid, the cephalorachidal liquid is gonna drain, and the brain is gonna go down. You can probably produce a herniation. That's why we don't do that. Next, cephalorachidal fluid finding. Okay, what do you think when you find this in cephalorachidal fluid? If you find low glucose and polymorphonuclear predominance, you're gonna think in a bacterial infection or bacterial meningitis. If you see normal glucose and lymphocytic predominance, you're gonna think in a septic viral meningitis. If you have numerous red blood cells in a series of liquid cephalorachidal samples, like a body sample, you find red blood cells in a series. You do a lot of samples and you see red blood cells in all of them. Could be a subarachnoid hemorrhage. So you see the same amount of blood in all the samples of liquid cephalorachidum that you find. So do you think in a subarachnoid hemorrhage? If you find elevation of gamma globulin, if you find elevated gamma globulin, you have to think in MS, multiple sclerosis. You have to think in multiple sclerosis when you find elevated gamma globulins in liquid cephalorachidum or cephalorachidum fluid.